The Kentucky drug-free workplace laws. And I'm going to be talking about these lectures here, following it pretty fast because you can read it a little bit later. But I wanted to point out a couple things that I have posted that I'll go back to a little bit later. One is a reasonable suspicion checklist. This is something that I think would be really handy for you to have. The other is the Kentucky drug-free workplace law itself, which I'll be talking about, and I'm going to click this in just a minute. And then a sample policy if you're ever in a position where you need to derive a drug-free workplace policy. Then I've got some links down here. One is to a movie on reasonable suspicion video, and that's something that I think would be pretty handy to look at a little bit later. And then a couple articles that I'll be talking about in just a couple of slides. But first, I'd like to take a quick look at the Kentucky Drug-Free Workplace Certification. So I'm going to click this, and this is came out in 2007 out of the Office of Workers' Claims. And this isn't really a law, but it says if you want to have a certification as a drug-free workplace program in Kentucky, this is the things that you have to incorporate within your policy. Here in Callaway County, Murray State University is not a drug-free workplace. Where my wife works at Murray Callaway County Hospital is. And so she is under the policy that is set forth within this document. And the talk that I'm going to be giving here is directed towards this document on the Kentucky drug-free workplace certification. So this is what I wanted to talk about, and again, this is just applicable to Kentucky, but many other states have comparable type policies in place. A couple of years ago, our then chair, Dr. Kramer's wife, was in charge of the Callaway County Substance Abuse Program and brought in Howard Taylor, who's a board-certified toxicologist from Nashville and the Nashville area. And since I'm also a board-certified toxicologist, we got along quite well. And he runs a lab within the Nashville area called the National Toxicology Specialists, and this is the information for that. But part of the training that he did here at Murray State, because Mrs. Kramer brought him in, he provided many of the materials that I'll be using here, and I've adapted them from his talk, but I wanted to at least credit him for this is a lot of his source material. He's also told me that if anybody has any questions about any policy things, if they're related to the program, let him know. So you can look him up on the drugtestinfo.com website and shoot him an email if this is an area that you need to get additional information on. One of the things that I think is important to understand about drug screens and drug testings in general is what they can and can't do. As a toxicologist, when I tend to go to court, which I don't like to that often, but it's mainly drug and alcohol cases, and I think there's a misunderstanding about what they actually mean. Can they measure whether or not someone has used a drug? Yes. What can they not measure? They can't measure how much they've used, when they used it, how impaired they are, how addicted they are. But if you test negative, that does rule out use. So there are some pros and cons with a drug screen measure, but it basically gives you the presence or the absence of the drug. The other things are a little bit more difficult to ascertain. So why do it? Why test? It's a problem. It costs a lot of money. Abusers give about 67 cents on the payroll dollar. They're 5 times more likely to have an accident, more likely to be absent, use more sick benefits, seek workers' comp. These cause you a lot of headaches and problems, so there's a lot of issues associated with it. What's the real problem? Who uses drugs? This is some older data when from Howard Taylor was here, but you can see marijuana, cocaine, and heroin are all used, and it goes over the spectrum of demographics. But what's important here is that most people who are using drugs are employed, so they're going to be people that are under your responsibility as a safety professional. And I wanted to go out of this for a second and just take a look at some of the links that I've put up for you under the links of interest. One is, let's look at the heroin overdoses first. This came out of Morbidity and Mortality Weekly Reports from the CDC, and this was published in October 3rd, 2014, so this just came out last month. I'm going to click up the PDF version, which you can download if you want to. I think it makes it look a little cleaner for the point that I want to make, but I'll scroll down to the second page and just look at this part and read this sentence where I have the cursor. The increase in heroin deaths parallels seen in individual states reported previously, 1 through 3. Kentucky reported a 279% increase in heroin deaths from 2010 to 2012. So we have a major problem here in the state of Kentucky with heroin usage that's really started to become more problematic than it was in previous years. The other thing that I wanted to point out to you is AIHA Synergist in the November 2014 edition, the one that I just got last week, had this press release, and they talked a little bit about the article says it's called "Workers Under the Influence," and it said the percentage of positive drug tests among U.S. workers has increased for the first time since 2013, according to an analysis of drug workplace testing released by Quest Diagnostics in September. And this is the article that they're talking about in the November issue of the Synergist. But it shows you that there are a lot more people who are testing positive for drugs than ever before. And in particular, marijuana use, positive tests have gone up fairly substantially, as well as amphetamine use. The other link from down here is the workers under the influence, and this is a paid-for type of training that is available from the American Industrial Hygiene Association, but it's something to think about if you have some issues with this area. But it talks about the problems of prescription drugs in the workplace and workers who are working basically high under prescription drugs and what to do. And you can take this as an online training through AIHA. Anyway, I just wanted to point out some of these sources that are available to you and the extent of the problem in many areas. Looking back, this is another issue. The Paducah Sun a couple years ago reported illegal drug use up sharply, so this just adds to the problems that we're seeing more and more and the importance of this particular topic. A lot of people are addicted in this country to a lot of different things. That includes tobacco, alcohol, and illegal drugs. And this isn't a career path that anybody sets out and say, I want to be a drug addict. But it's a progressive disease, and it's very sad and the toll it can take. It's the #1 disease in America. It's progressive, chronic. It leads to a lot of self-destructive behaviors, and every family in America is affected by it. In fact, I could get into some personal things about this, but let's just say that both sides of my family, my family and my wife's family, have all had children that have had addiction problems, and it's been heartbreaking for all of us to have to deal with some of the issues that they've had due to this problem. So it goes across the whole spectrum. Everybody deals with it, and there's no cure. Treatment requires a lifetime commitment, and usually treatment is some kind of a program, a 12-step type program. But if anybody has a problem with this, they need to ask for help, and there's a lot of resources available to try to help people. Anyway, back to the Kentucky law. What's required? These are the things that are required here that are listed: a written policy, training, initial training for employees, refresher training for supervisors as well, collection procedures that are similar to what the DOT has, testing and certified laboratories, reviewing results, having programs that will help people, and counseling available through a substance abuse professional. So all these are elements that are within the Kentucky law. And they require that somebody be designated in charge, a designated employee representative. They talk about who's covered. I mentioned my wife is covered under this policy at the Maury-Callaway County Hospital. They have employees that are subject to rule there. The physicians are not covered by this rule. All other hospital employees are. And they have, the policy has specified circumstances for testing, either pre-employment, random, etc., what the procedures are, and the consequences if you have a positive drug test. The policy will have prohibitions on the use, sale, manufacture of illegal drugs on the premises, and some other aspects to it, including what happens if you refuse to submit to a test. There are consequences with this policy, which could include termination, and there is a provision available that if you have a problem, you have a problem, you're going to fail a drug test, you can voluntarily self-report yourself, and that would result in a referral to a substance abuse professional. The policy also has covered employees have 1 hour training, supervisors 2 hour training, both on drugs and alcohol. And the types of testing that are structured are pre-employment and then a random testing protocol. If there's an accident, the post-accident testing, reasonable suspicion, which I'll spend a little bit more time on, return to duty, and follow-up. And a return to duty is similar to what you hear about in the pro football teams. When someone's tested positive, when they come back, they have to take more tests than the rest of the members of the team do because they are returning to duty and they've previously tested positive. The random testing is based upon DOT trucking guidelines, which is set at 50%. And for random testing, testers will show up unannounced. Donors proceed immediately to a site. And these are supposed to be structured so they're reasonably spread out through a calendar year. Post-accident testing for both alcohol and controlled substances are time frames, and if you don't test within those time frames, there needs to be a record of explaining why you did not. And then reasonable suspicion testing. This is based upon the federal law, and the government has laws for drug testing that apply to federal employees and contractors. And the Kentucky law incorporated elements of that for certain aspects, including requirements for reasonable suspicion testing. These are tests that need to be specific, contemporaneous, articulable, and they require documentation concerning the appearance, behavior, speech, and body odors. Now, I wanted to go back to our course guidelines here, and I've got a couple of documents that I wanted to show you. The first is this reasonable suspicion document checklist, and I'll open it here. Should have opened it beforehand, but okay. Make this look a little prettier. This is a handy piece of document for you to download and to utilize, because what it does is it helps you make properly document if you think somebody is showing up at the workplace under the influence of alcohol or drugs. It gives you a process and procedures to follow. And that's real important because most people are going to deny that they have any type of an issue with this. And so this gives you some things that you can check on: behavior, appearance, speech, like if their speech is slurry or things like that, if they smell like alcohol or marijuana. And it gives you an opportunity to have witnesses and supervisors sign off on this as well. So it's a nice way of documenting that you can't just say, well, I think they were drunk. You can say they were loud and boisterous. They were talking excessively. They had dilated pupils, bloodshot eyes, etc. There are a lot of things that you can actually document which would support that you think they're under the influence of some kind of an illegal substance. The other thing is the reasonable suspicion video. And I'll click on this link, and this takes you to the site for the United States Department of Transportation on the Federal Transit Administration. And there's some pretty good information here, but this video, I'd recommend that you watch it. It's about 20 minutes long, and it takes you to a process of how you approach individuals who you suspect may be under the influence, and how to properly use these principles that are on that sheet to document what you're observing. But again, I'm not going to go through that video now, but it's something that I would encourage you to watch, especially if this is an area that you have some job responsibilities in. And the video does help you with some of these techniques, because if you confront someone that you think is under the influence of drugs or alcohol, it's not going to be an easy thing. And so there are some techniques that are in these next couple of slides that can help you. But you need to be a leader, and you need to thoroughly understand the policy that you're using, and you need to have some documentation for your reasonable suspicion. You need to the employee discuss the policy, etc. And what's going to happen is you may have a very emotional, angry outbursts directed towards you, and you just need to stay calm and uphold the policy, and realize that this is a person that has some type of a problem, and they're not going to recognize this or admit to it generally. For reasonable suspicion testing, there's a couple things that are really important. You need to remove the person from the area they're working, drive them to a collection site, have the test performed, and then very importantly, drive them home. You don't want to say, I think you're under the influence of drugs or alcohol, take them to a site and leave them there and have them drive themselves home. Then you'd be equally culpable to what they did. So you need to make sure that you drive them home as well, and have documentation in place for this. This is kind of interesting. Kentucky has a drug panel that's a little bit unique. They test for the substances that are on this slide. Most of them make sense: amphetamines, cocaine, marijuana, opiates, phencyclidines, benzodiazepams, barbiturates, etc. But they also test for quaaludes. Quaaludes haven't been used in the United States since the 1980s. Dr. Taylor said he's never seen a positive test on one. But if you do the Kentucky certification, you have to send off a sample to the lab, and they test for these substances, including quaaludes, knowing full well that you're going to get a negative test on the quaaludes. And the rest of these slides just have an overview of the different drugs of abuse, and I'm not going to really talk about them much. I will mention a couple things on marijuana. It's gotten really interesting with the legalization of marijuana in Washington, D.C., the state of Washington, and the state of Oregon. Oregon and Colorado have come up with a number of nanograms of THC metabolites in the urine that demonstrate impairment. If you're in Kentucky, the laws here are any metabolites indicate impairment. So if somebody goes to Colorado for a weekend and smokes a joint and then comes back to Kentucky and works and has an accident, and they're tested and they have the presence of metabolites, it's assumed they're impaired, even though they may have not smoked marijuana for a week. But marijuana does tend to stay in the system for a while, and these are just some symptoms of marijuana. Cocaine is another problem. Opioids, as I mentioned, the opioids, the heroin is really making a resurgence, and it's very large within this particular state here, with almost a 300% increase in deaths in the last couple of years. And they do things like make you drowsy. Methamphetamines are a huge problem. If you go to the AIHA conference, they have a little trailer for a mock met lab, and it's kind of interesting. You can go through that, and they talk about some of the things that are used in the production of methamphetamine and some of the precautions that first responders need to follow to make sure that they're not exposed to some of the chemicals, which can be extremely hazardous within for methamphetamine manufacture. But that's a big problem within the state, and as you can tell, it causes long-term physical effects. And then angel dust and barbiturates, benzodiazepams, Valiums, etc. And this is just a little bit on urine testing. There's a chain of custody. Testing has got to be at a certified lab, and the lab reports to a medical review officer. The reports go back to the company designated employer representative. There's really two types of tests, and I had a lot of training in analytical chemistry, so I get this, but if you haven't, what typically happens is you have screening methods, and screenings are usually immunoassays, and these are kind of quick and dirty and inexpensive type tests, and there are a lot of them out there. And if you have a positive with a screening test, you want to get as sensitive as you can and as specific as you can, but you want to make them so that they're pretty quick and dirty and easy to do. And a positive screening test doesn't necessarily mean a positive drug test, because screening methods, by their very nature, are going to pick up other things rather than what you're trying to measure. So if you get a positive screening test, it's typical that you'll do a confirmatory test. And a confirmatory test is usually done in a laboratory setting with the GCMS, which is a gas chromatography, mass spectroscopy. These machines cost millions of dollars. They have a fingerprint library, and so if you You don't want to run as many samples on a GCMS as you would with an immunoassay. You can screen everybody with an immunoassay, but if you get a hit or a positive test, then you take it to the lab and you do a confirmatory method. And that's going to generally cost quite a bit of money, and so you try to minimize that and make your screening tests as good as possible. But the confirmatory tests are, if you're positive on a confirmatory test, that's a positive drug test. And again, there's a lot of different types of immunoassays, ELISAs, etc. And a confirmatory test is you're going to be your spectroscopy test where you have a fingerprint of that particular molecule. And which drugs are tested? It depends on where you are. Here in Kentucky, we have to do the 11-panel test that includes the Quaaludes. A lot of places will do a 5-panel test, which includes THC, marijuana metabolites, coke, amphetamines, opiates, etc. Some will add some of the benzodiazepams and barbiturates. And just a little bit about drug retention times. If you've ever taken toxicology with me, we study this a little bit. You tend to metabolize about a drink every hour and a half. And so if someone drinks at 8 o'clock in the morning and has 2 drinks and you test them at 5 o'clock at night, they're going to test 0. So timing on alcohol is pretty important due to its, most people are going to metabolize a drink in about an hour and a half or so. Marijuana is much more has much longer residence time and can be detected for much longer periods of time, and that tends to be increasing as we get better with our detection methodologies. But if you go and smoke a joint on the weekend, on Saturday, you can probably detect it up until about Wednesday. If you smoke every day and you have a drug test, it'll be present for 4 weeks. I once had someone call me when I worked in Arkansas. We used to have to answer the phone for any toxicology questions, and they were wondering if you used to smoke marijuana and you lost a lot of weight, if it could show up in your bloodstream or urine test. And I said, of course, because marijuana, unlike alcohol, is stored in the fat cells. So it can have a very long residence time in the body, even though it may not be detectable. It's in the fat cells. So if you lose a lot of fat cells, it has to go somewhere, and it's going to be excreted into the blood or the urine. And then he said, could you come down to the courthouse and tell my parole officer that? I said, no, I'm not going to go that far, but that theoretically could happen. Some of the other drugs will last for a couple days or PCBs up to a week. But marijuana does tend to have a fairly lengthy residence time, and it's due to the fact that it accumulates in fat cells, unlike most of the other substances of abuse. And there's always some questions. If I eat poppy seeds, can I test positive for opiates? No. If I'm sitting around a room where people are inhaling marijuana and I'm there, can I test positive? Unlikely. And then there's urine tests. Can you beat them? No. You really can't, because what they're looking at is specific gravity of the urine, as well as a creatinine, which is a protein that's normally excreted in the urine. If you try to beat a drug test by drinking 5 gallons of water, it's going to dilute your creatinine levels, and that will be an invalid sample. So you can't beat them by this methodology. So people will try that, and you've got to have a policy that puts in place that what to do with diluted urine. There are other specimens that can be used as well for drug testing. You can see these when you go to ASSC or AIHA meetings. Some of the vendors will have drug testing methods that include hair, saliva, sweat patches, on-site testing of different types of drugs. But if you do this, the chain of custody is very, very important. And then there's a whole little side industry on how to try to beat them. Policies also need to have a provision on what to do if somebody refuses to submit. And then if you don't cooperate, what will be the consequences to that? There's a whole lot of people that try to sell adulterants, try to make your urine clean, but they're unlikely to work very well. Alcohol tends to be measured in either blood or breath, and Alcohol again is eliminated a drink about every hour and a half, and it follows the water compartments of your body. And people cannot vary the rate of alcohol elimination. Again, if you take toxicology, it's a little different than most chemicals that you take into your body. So only time is going to work to eliminate alcohol. It doesn't matter if you drink coffee, do push-ups, take a cold shower, etc. About an hour and a half per drink per person. And how much does it take to get up to a legal limit? Not that much. It's you have a lot of variation with individuals, but mainly it's the amount of water compartments you have in your body. If you're obese, you have less of a water compartment. If you have lean body mass, you have a greater body compartment. And like I said, I've done a lot of these cases, and it's been sort of surprising when you do predictions or tests on what alcohol levels are going to be. I've had some cases I've tried to defend people that have been under the influence. They were the designated driver, and they had 2 Bud Lights, and it's like, how could I be intoxicated? And it's like, well, you weigh 110 pounds, you don't have that much lean muscle mass, and it's not that difficult for you to get up to a 0.8 with that amount. So there's a lot of individual variation that you'll see with alcohol levels. And it does change on absorption on a full versus an empty stomach. And they're all the same. If you take beer or wine or distilled drinks, they can, alcohol is alcohol, and doesn't really matter how you get it as long as you get it inside of your body. Some of the craft beers can have percentages of alcohol double what the typical Budweisers will be. Budweisers are around 4 or 5%. A craft beer maybe 7 to 10%. Wine is about 12%, and 80 proof is going to be 40%. So getting the alcohol is going to have the effect. And this just says a 12-ounce beer is equal to about a 5-ounce glass of wine or a shot of whiskey. And that's it. Again, this is just sort of an overview of one specific policy and some information sources that I think will really be helpful if you're in a position where you have a company that is putting into place a drug testing policy and procedure.